CBD is now being used to treat anything from nausea to insomnia. But what is CBD and how much should you take? Joining me now to answer those questions is Dr. Hary Ailinani with Summit Pain Management. Thank you for joining us.
Thanks for having me, Alyssa. Appreciate that.
So let's start with, what is CBD?
Well, CBD is a compound that's derived from the cannabis sativa plant, but I guess with respects to how we're talking about it now, hemp. And it's a compound that has a vast array of applications with regards to health. Again, in our practice, we use it quite a bit with regards to managing pain, inflammation, sleep, anxiety, blood pressure, even seizures. In some patients have been responding extremely well to CBD.
But it is not marijuana, so where does CBD come from?
Thank you for asking that question. So no, it is not marijuana. There are two types of CBD, isolate and full spectrum. Both have great medical benefits. Isolate doesn't have any THC in it at all, so we don't need to be concerned about that. And in full spectrum, the amount of THC in it is less than 0.3%, so it's non-psychoactive. It will not affect your mind or cognition. Yes.
Okay, so if someone's using CBD to treat like insomnia or anxiety, how much do you take? What do you know the right dose is? Can you overdose?
So that's a great question. The dosing spectrum for CBD is very wide. I generally, when I talk to patients about this when we start, I recommend anywhere between 5 to 50 milligrams 1 to 2 times a day. And I generally just have them start it in the evening first to see how they respond. If it makes them drowsy, perhaps before bed to help with sleep, and even with benefits the next day. If you're tolerating it well, we'll then have them increase it to twice a day to get more benefit throughout the day.
So you kind of start a little bit lower and then you can work your way up.
We start low and go slow and generally increase by 5 to 10 milligrams at a time and slowly titrate up.
Now, are there any side effects to CBD?
Very few. Again, with regards to other medications that we use to treat pain, including over-the-counter medications like ibuprofen or Aleve or other medications called NSAIDs, CBD has a very low side effect profile. Every so often we might get a patient that has some GI irritation with it, or some patients where it makes them a bit fatigued, but outside of that, people tolerate it very well.
Definitely expanding the range of your treatment options.
Absolutely, absolutely.
Thank you so much for joining us. You can find out more about CBD and Pure Stasis CBD products by just calling the number there on your screen.